Hello, I'm Keonda. I'm going to present my case to you. BD is an 18-year-old Caucasian female with a birth date of 5/31/2008. She presents to the clinic alone and is a reliable historian to her own personal medical history. Subjective, she has a chief complaint. I am having an odorous vaginal discharge. HPI, an 18-year-old female comes into the office complaining of an odorous vaginal discharge. She states that she does not have any vaginal pain and or cramping. She denies having symptoms like this in the past. She reports that she was a virgin before she met her boyfriend about a month ago. She states that she is currently sexually active with one partner. BD states that her symptoms started about 5 days ago. She attempted to use an over-the-counter Monistat as she thought that she had a yeast infection. She has no past medical history. She's currently taking no medication. She has no allergies to food, drugs, and our environmental allergies. She has no past medical history. There is no pertinent family history. She denies illicit drug use and alcohol usage. She currently lives in a 2-bedroom dorm with her roommate. She is not married, but she has been dating her boyfriend for 1 month. She is currently going to school at the local university. She states that she has only had sex with one partner and she only has sex with men. Review as far as sexual practices. She states that she only had sex 2 times with current boyfriend and she did not use any condoms and she's currently not taking any types of birth control. Review of systems. General. Denies any types of fevers, fatigue, malaise, weakness, weight loss, weight gain. HEENTI, she denies any types of nystagmus, blurred vision, loss of acuity, ears, nose, and throat. She denies any types of hearing loss, postnasal drip, and cough. Mouth, she denies sore throat, mouth pain, or mouth ulcers. Skin, she denies any types of skin eruptions, moles, or open areas. Cardiovascular, no chest palpitations or chest pain. Neurologic, denies seizures, Bell palsy, strokes. Respiratory, reports no cough and or shortness of breath. Gastrointestinal, reports no concerns with nausea and vomiting. Genitourinary, she reports no pain or burning upon urination. Musculoskeletal, she denies any joint pain, stiffness, and or muscle pain. Lymphatics, denies any lymph node swelling. Reproductive, she denies pregnancy. She's currently sexually active. She reports she has some gray tint vaginal discharge that started about 5 days ago. She stated her last menstrual period was 11/1/23. Psychiatric, she denies depression, anxiety, and bipolar. Allergies, denies concern with allergies and or being immunocompromised. Objective, her vital signs. Heart rate was 84, blood pressure was 118/70, temperature was 98.3, respirations were 20 and non-labored, pulse ox was 100% on room air, pain was 0 out of 10. She's 5'7", she's 145 pounds, she has a BMI of 22.7. General, she's alert and oriented. She appears to be in no distress. She is well nourished and dressed appropriately for the weather, and she's well groomed with her hair pinned in a bun. HEENT, on assessment, her head is round and symmetrical with no lesions or masses noted, no conjunctivitis noted within the eyes, pupils, or pearla. Bilateral ears were symmetrical and no erythema or swelling noted. Tympanic membranes were assessed and were pearly gray in color. No swelling and erythema noted to the throat. No deviations noted to the septum. No nasal drainage. Mouth is free of any lesions or ulcers. Neck has full range of motions. No palpable nodules noted on exam. Respiratory, her chest wall expands equally on inspiration and expiration. Lungs were auscultated and are clear in all bases. Cardiovascular, heart rate is regular with no gallops or murmurs noted. Genitourinary, upon vaginal exam, there was a moderate amount of gray-colored vaginal discharge along the walls of the vagina. There was a slight odor to the discharge. There were no lesions or ulcers present within the vagina area. The cervix were visualized and were within normal limits. Upon digital exam, ovaries and cervix were palpated and no masses or abnormalities were noted. Assessment. A saline wet mount and urine dipstick were performed in the office today. Cultures were also taken and sent off for STD testing to include gonorrhea and chlamydia. Differentials. Bacterial vaginosis. The classic signs of BV include an off-white colored vaginal discharge that may present with a fishy type odor with sexual intercourse. This has been considered as the patient had a positive whiff test in the office today, and she did have gray tint colored discharge with a slight odor. Her vaginal pH was 6. We also did a wet mount, and clue cells were present and seen under the microscope. Gonorrhea. Symptoms include pelvic pain, bleeding in between periods, and a green frothy like vaginal discharge. This has been ruled out as she currently does not have any of those symptoms. Chlamydia is another STD that presents with pain with urination, back pain, fever, nausea, pain with sex and pelvic pain, and vaginal discharge. This has been ruled out as the patient is currently not having any of those following symptoms except for the vaginal discharge, which is specific to gray tint, which is common in BV. We're going to treat her with 500 milligrams of Flagyl POBID for 7 days. We're going to educate her to practice safe sex, to use condoms. We're going to educate on the different types of contraceptives to prevent pregnancy. We're going to tell her to take all medications as ordered, even though she may start to feel better. She may take with food if she gets an upset stomach, and she's going to report to the ER if she were to start having excessive bleeding, and she is to return back to the clinic if her symptoms were to worsen. Thanks, and I hope you enjoyed the presentation.